Hi, Dr. Harrison here, and today I want to talk about a common complaint that we see in our office, and that is low back pain. Obviously, as a chiropractor, most people are aware that we treat people with back conditions or spinal conditions, and low back is one of the most prevalent. Probably because in our daily life, we're very active and most people are bending, twisting, lifting if they're in a manual labor type job, or they're sitting and sedentary at their desk, and then they get up to do something and those muscles have been weakened over time. So many times we'll see people with lower back pain. And usually we break that down into a few different categories as to what's driving that back pain. Usually things have been progressing for a while before that pain actually appears, unless it's a trauma or something like that. But most often these are gradual onset of symptoms over time due to that sedentary lifestyle, or again, maybe they've been doing repetitive things at work that have slowly weakened the spine over time and it finally gives way. Most common cause of back pain that we see after doing a thorough exam and usually taking some films to rule out the dangerous things, the most common thing we see is just tight muscles and restricted mobility, which is what you would see with a sprain strain or just the gradual tightening of muscles around the spinal joints. So when we see the x-rays with these patients, typically everything's going to be in good alignment. Everything's going to be lined up from top to bottom. On the front to back view, everything should be straight. On the side view, there's normally an arch or a curve in the spine, and things will look completely normal. And if we've ruled out the dangerous things, then we know we're dealing with tight muscles and restricted mobility. Usually those respond very, very quickly to a few adjustments. Maybe 2, 3, 4, sometimes 5 to 10 at most, and pain just alleviates very quickly. So that's the number one that we see and the easiest to fix. Second most common cause is we will see the same thing, tight muscles and restricted mobility, but maybe the spine has shifted. So on the x-ray, maybe on the front view, we might see that one or more of the vertebrae have rotated, or maybe one is tilted out of its normal position. And any of you who've had severe back pain, sometimes you know that you feel like you're a little crooked when you're standing. And so on the x-ray, there's a reason for that. We'll see an actual shift in the structure. Along with that, we still get tight muscles and restricted mobility. And so these patients are a little bit more difficult to fix. Takes a little bit longer because now, in addition to getting the muscles to relax and getting the mobility back into the joints, now we have to realign that structure. And depending on how long that's been going on or how long it's been out of alignment, it may take some time to do that. Every patient's an individual. The third most common condition that we see is, along with those first two, now we might have some arthritis in the spine. So on the x-ray, we'll see a thinning of the disc space, which is the space in between the vertebrae. The disc is a soft tissue, so when it's starting to wear thin, we'll actually see the bones coming closer together on the x-ray. We might see bone spurs beginning to develop, which are calcium deposits that the body is laying down trying to stabilize the area. Obviously, this is a chronic condition. It's going to take longer to heal, so we need to work with these patients until we get things moving as best we possibly can. Obviously, it's very difficult to reverse any arthritic condition. For the most part, we're lucky if we can stabilize these and prevent them from going forward. So we get the patient out of pain, we give them exercises to do at home, and it's always a good idea to come in periodically to make sure we keep the joints moving, which will slow down the progression of that arthritis in the spine. So that's the third most common, and then the last is either a disc herniation or a disc bulge. Almost everybody knows someone who's had a lower back surgery related to a disc herniation. And our job is to try to prevent you from having to go down that avenue, because that's going to be time out of work. It's invasive. Obviously, there are risks associated with the surgeries, so we really want to prevent you from having to go down that road. Typically, the adjustments, many cases, in many instances, will work. It may take some time to get the disc to calm down, and we use modalities in the office to do that. Ice, obviously, interferential therapy, which is muscle stimulation or current to help stimulate the body's own endorphins or painkillers to help downregulate the pain and break that cycle of spasm. So there's a lot we can do to help with those disc problems. If we run into a difficult situation, obviously we can always refer you out to an orthopedist to have them look at the back, but ideally we want to keep it in-house. And another great modality that will help avoid back surgery is spinal decompression, and we're going to talk about that on another video. I hope this has been really helpful for you, and if you have any questions at all, please go ahead and call the office, 407-522-5858. Have a great day.